In this morning's Health Watch, families living with Alzheimer's, a new worldwide study is following multiple generations of families that have faced early-onset Alzheimer's disease.
In those families' genes, researchers are finding important new clues in the search for a cure. CBS News contributor Priya David Clemens now has more.
Has the horse in his pocket.
Doug Whitney and his family say they always try to live life to the fullest during the good times and the bad.
This picture is my mother and her 13 siblings.
10 of them died of early onset Alzheimer's. And out of those 10, 8 of them died before they were 62. And out of that, there were 7 that died before they were 55.
His mother Mildred was one of them. The disease gave her intense delusions that her children were trying to harm her.
Everybody was suspect. I mean, she would actually get up and manage to get out of the house and try to run away. Somebody would have to go get her and physically bring her back. That was a hard thing.
So when Doug turned 50, his wife Ione and 2 children, Brian and Karen, watched closely for signs his memory was failing. But Doug stayed symptom-free.
When 60 rolled around, we really did think, he must obviously not have it because he's not even showing any signs of it yet. So
Doug thought he was safe, but wanted to see if his children risked having the disease. So when he was 62, he agreed to participate in the Dominantly Inherited Alzheimer's Network, or DIAN, study, a $14 million, 6-year international project about genetically transmitted Alzheimer's.
We believe that the genetic test itself, that when it's positive, is nearly universally predictive of who will get Alzheimer's disease.
The groundbreaking study is following patients over 6 years whose parents test positive for a genetic mutation known to cause Alzheimer's.
About 20 years before people will have the first signs of memory loss or dementia, there are already changes occurring in the brain. And what that does is it offers a window of opportunity for which we can intervene in that process.
Doug tested positive for the genetic mutation.
He said, "I'm sad that I can't tell the kids. They don't have to think about it."
That was the purpose of going through the counseling and getting the test done in the first place, so I could ease their minds. And now I can't do that.
However, this now makes Karen and Brian eligible to participate in the study.
a little nervous today, but it'll be good.
For 3 days, they undergo spinal tests, PET scans,
Research studies.
DNA indexing, and memory tests.
So what was that name and address you were going to remember?
John Brown, 42 Market Street, Chicago.
Perfect. All right.
So far, 30% of study participants have developed Alzheimer's symptoms.
Someday my brain may not be able to tell me.
Karen fears she will one day be one of them.
How scary that is to know that your mind you're not in control of yourself. So
Even though they've been tested, Brian and Karen say they're not quite ready to learn if Alzheimer's is in their future.
I don't know what the challenges may or may not be once I find out of the status of my mutations.
Already, 5 of Doug's family members are participants in the DIAN study. His brother was in the study but died at 55. More family members start testing later this month.
it's an awful thing to think about and it's an awful thing to talk about, but at least having gone through it, it gives your family a way to connect about it.
For Doug Whitney,
They're making such great progress.
the study means he finally gets to witness some good come of the disease.
I can't help thinking that by the time she's in line, it won't be a problem.
Priya David Clemens, CBS News, Seattle.
And of course, that's what you have to hope for. Researchers in the study say they are now less than a year away from testing drugs and therapies that may catch Alzheimer's in its early stages. And boy, what a bit of relief that would offer for so many families across this country.
Exactly.